Good day, everyone. We're going to present to you a research study entitled Self-Assessment and Specialty Preferences in Clinical Exposure of Student Nurses. I am Michaela Denise ALMADIN, and along with me are my groupmates Samantha Ashley ABARQUEZ, RENSUS Joy ASPLICO, and Daniella May ATESORA. For the purpose of the study, the World Health Organization predicted a need for 10.6 million additional nurses and midwives by 2030. As the need for nurses continued to grow, it became essential to comprehend their selection and progression across various clinical specialties in their careers. Thus, this study aimed to investigate the self-assessment of specialty preferences and clinical exposure among student nurses. Understanding how student nurses assess themselves in their specialty preferences during clinical exposure was essential for guiding their career development and supporting the nursing workforce's needs. This research contributed valuable insights to nursing education, healthcare institutions, and the nursing profession as a whole.
This study utilized a quantitative descriptive research design, primarily employing survey methods to systematically collect data on student nurses' specialty preferences during their clinical exposure. This approach ensured standardized and structured data gathering, providing comprehensive insights into their choices and interests in a methodical manner.
For the participants of this study were the level 4 undergraduate student nurses from local university in Bacolod City. Level 4 student nurses who were 21 to 23 years of age were associated with these specialty preferences and clinical exposure. A stratified random sampling was employed in this study. The level 4 student nurses enrolled in the academic year 2023 to 2024 were composed of population of 267 students. The researchers only needed 160 students to be surveyed. In selecting students to respond to the survey, the researchers employed the fishbowl method.
So this study utilized a researcher-made quantitative survey questionnaire, designed in three parts. Part 1 focused on demographic information and participants' general weighted average. Part 2 addressed what clinical exposure participants has been exposed to, and Part 3 explored preferred nursing specialties during clinical exposure, with a table provided to determine clinical settings. The questionnaire aimed to identify specialties of interest and assess students' proficiency levels. Likert scale was used for evaluative statements. Overall, the instrument facilitated comprehensive data collection on participants' demographics, clinical exposure, and nursing specialty preferences, providing valuable insights for the study.
For the demographic profile of the participants includes sex, age, religion, and GWA. In terms of sex, 78.1% of the respondents are female student nurses, whereas 21.9% of the participants are male student nurses coming from level 4 of the university. With regards to age, the majority of the participants belong to the 22 years old, comprising 75.6% of the total population with 121 students. As for the religion, the majority of the participants identified as Roman Catholic, constituting 75.6% of the total surveyed population, with 121 students belonging to this religion. As to the general weighted average, the majority of the students fall within 91 to 95 GWA range, comprising 57.5% of the total surveyed population, with 92 students achieving this level of academic performance.
In Level 4 student nurses clinical exposure, the most preferred nursing specialty among Level 4 student nurses, with a mean rating of 4.45, is operating room nursing, known for its immersive environment and opportunities for hands-on experience in surgical procedures. Following closely is emergency care nursing with a mean rating of 4.09, appealing to students for its fast-paced setting and emphasis on quick decision-making under pressure. Labor and delivery nursing secures the third spot with a mean rating of 4.08, offering students a deeply meaningful experience in maternal and newborn care. Psychiatric nursing ranks 4th, followed by geriatric nursing and obstetrical nursing in the 5th and 6th positions. Community health nursing and ambulatory care nursing are ranked 7th and 8th, respectively, while intensive care nursing is the least preferred nursing specialty. Moreover, it is worth mentioning that the top 3 preferred specialties, the operating room nursing, emergency care nursing, and labor and delivery nursing, all originate from the category of transitory nursing. This category is recognized for its dynamic and fast-paced nature, providing students with a challenging yet enriching clinical environment. Students are often exposed to these clinical areas due to the required number of cases for the PNLE, which may play a crucial role in influencing their preferences and interests within the nursing field.
The study found no significant relationship between level 4 nursing students' preferences for operating room nursing and demographic variables such as sex, age, religion, and academic performance. This implicates that these factors don't strongly influence students' inclination toward or against operating room nursing. Instead, individual interests, exposure to clinical experiences, and personal career aspirations play pivotal roles in shaping nursing specialty preferences.
For the significant relationship between emergency care nursing specialty of the level 4 student nurses and the profile variables, there is no significant relationship between the emergency care nursing and the profile variables age, sex, religion, and GWA. Therefore, the null hypothesis is not rejected at 0.05 level of significance. This implies that the significant relationship between emergency care nursing specialty and profile variables among level 4 student nurses suggests that understanding the emotional experiences of students is essential for tailoring support strategies based on individual profiles. Factors such as prior experiences, personality traits, and coping mechanisms may influence how students respond to the emotional challenges of emergency care nursing. For the significant relationship between labor and delivery nursing specialty of the level 4 student nurses and the profile variables, there is no significant relationship between the labor and delivery nursing and profile variables age, sex, religion, and GWA. Therefore, the null hypothesis is not rejected at 0.05 level of significance. This implies that promoting the unique aspects of labor and delivery nursing, such as the dynamic nature of childbirth, the variety of clinical scenarios, and the potential for career advancement, can appeal to students seeking these opportunities. Moreover, the emphasis placed by students in transitory care specializations and practical skill challenges, individual patient care, and acute event management aligns closely with the demands of labor and delivery nursing. Therefore, highlighting the hands-on clinical experiences, the one-on-one patient interactions, and the adrenaline-inducing nature of childbirth emergencies can resonate with the students considering this specialty. For the conclusion, Level 4 nursing students are predominantly female, around 22 years old, and mostly Roman Catholic with high academic performance, reflecting societal norms and cultural influences in nursing career choices. Their preferences for specialties like operating room, emergency care, and labor and delivery nursing are driven more by personal interests and clinical experiences rather than demographic factors, highlighting the need for diverse clinical exposure to support informed career decisions.
The following suggestions drawn from the study's findings and conclusion may prove beneficial for the following sectors. The university administrator can tailor nursing programs for preferred specialties and address factors behind less favored areas to enhance engagement and relevance. The College of Nursing faculty can provide personalized guidance for preferred specialties and explore factors influencing these preferred areas, fostering discussions and initiatives. The nursing students can identify interests in favored specialties and explore reason behind their least preferred areas, empowering them to advocate for changes. Parents can gain insights into their child's career aspirations and factors influencing their least preferred areas, enabling meaningful discussion and support. Lastly, future researcher can refine curricula for favored specialties and explore innovative approaches to address factors contributing to least preferred areas, promoting holistic understanding and enhancing student engagement.
So that would be all. Thank you for listening.